There we go. Now we're all set. Okay, so again, thank you everybody for coming. Today I'm going to talk about what I've titled Foundations of Trauma-Informed Investigations, and I think that all of you will probably agree that this has become a very hot topic of late, and it continues to be an important topic, and something that it's actually hard to find a lot of information about trauma-informed investigations and trauma-informed approaches to investigative interviewing. So I've done quite a bit of research on this and wanted to share my thoughts and some of my learnings with you today. And so what I'm going to do is take you through a bit of an agenda today. So you'll see here, I'm going to talk about understanding the psychological factors that affect victims of trauma. I think that's where it all starts. If we don't understand the victim, then how are we supposed to provide trauma-informed approaches to aid them? So we're going to talk about that, and then talk about our own biases and the impact that those biases can have on our work. And for those of you who think that you don't have any biases, guess again, we all do, every one of us. We'll talk about diversity and intersectionality, and I'll explain what intersectionality is as we go forward, and how that impacts investigations and how it ties in to the issue of providing trauma-informed approaches. And we're going to talk about techniques to manage communications, effective interviewing, and I want to talk a little bit about something called vicarious trauma. And what I mean by that is the trauma that we, as individuals who work with people who are suffering from trauma, and as we have to listen to and take in the stories of trauma, how that can affect our own mental health. And I want to talk a little bit about what we can do to protect ourselves from that. Somebody has asked if they can get a copy of the slides. I'm going to be posting the entire presentation on YouTube. So the whole presentation, including the slides and me talking, will all be on YouTube for everybody to access. And you can access that at the Benard Associates YouTube channel. Now, before I get into everything, I did want to provide a couple of caveats and acknowledgements. And I think these are important because I don't want to come across as being something that I'm not. And so I think it's important for me to just say right from the outset that I'm not an expert in psychology or brain biology and physiology. I'm learning like everyone else. And many of the things that I'm sharing with you has been obtained through various resources. And I do have a final slide on the presentation that references the resources and sources that I've used for much of the information that I'm sharing with you today. So I think that really together we can make a difference in people's lives and how people access and deal with our justice system, and in particular our little corner of the world in regulatory investigations. What we need to do is make the system more accessible and tolerable for those who have unique experiences and challenges that it behooves us to consider and really work with. So what is trauma? Now, the Center for Addiction and Mental Health has provided what I think is a pretty succinct and useful definition of trauma. And it is the lasting emotional response that results from living through a distressing event. And experiencing a traumatic event can obviously harm a person's sense of safety, sense of self, their ability to regulate emotions and navigate relationships long after the traumatic event occurs. And also long after, people with trauma can feel shame and helplessness and powerlessness, and intense fear. And so we, as investigators doing the work that we do, are bound to come across many people that have suffered from trauma. And it's important that we recognize this. Now, when we think about trauma, we tend to, I think most of us, our imagination or our thoughts tend to go to, violent, awful, horrible things that can happen to people. But events don't have to be violent to create trauma. Trauma can be related to being exposed to a traumatic event or being part of a traumatic event. But, it could be violent, assaultive behavior. It could be psychologically, physically, or sexually abusive conduct. It could be related to experiencing errors that have significant consequences. And what ends up happening is the trauma really is it's something that that can form either an acute, a chronic, or a complex type of trauma. So acute trauma might just be a single event that somebody has experienced, and it's the trauma may be short-lived, it may be long-lived, who knows, but it might just stem from a single event. Sometimes it stems from chronic events. Could be a long history of abusive behavior, either as a child or at any stage of our lives. And then there's complex trauma, which can be really severe and long-term trauma. And we can get into some really horrific examples of that. And I'm going to try today to avoid getting into a lot of gory detail and examples of specific traumas, and speak more about trauma in general. The bottom line, though, is whether it's acute, chronic, or complex, the effects of trauma, really both short and long term, can be devastating. It can really negatively affect a person's ability to function. Now, I think it's important to understand that we're not all the same. So when we think about how we respond to trauma, it's important to recognize that we're not all going to respond the same way. And what might be traumatic to me may not be to you. I think back to my past lives working in nursing and policing, and I can tell you I've seen some horrific things. None of those things ever impacted me in a way that I couldn't cope with. Now, I was in both those professions for a relatively short period of time. So who knows, had I stayed in those professions for a longer period of time and had more of a chronic exposure to some of those horrific events, who knows where I might have ended up in terms of my psyche. But then, frankly, there's people I know and know of who've experienced one event that, from my perspective, wasn't what I would describe as being terribly traumatic, but it severely affected them. And that's why it's so important. Really, the key here is that we don't judge, because people's response to an event it's not a competition. It doesn't make me a stronger person to say, well, that doesn't bother me, despite the fact that it bothers that person. It isn't necessary to go down that path. People's trauma is not something to be critical of. And I think, sadly, there is a little bit of a temptation or a tendency for some people to be critical of one's trauma, questioning, well, how bad could it have been? And we have no right to do that. And we have to remind ourselves of the fact that we don't have a right to do that. Now, in terms of how we respond to trauma, there's that immediate response, right? So the fight, flight, or freeze type of response. And that's typically beyond our conscious control. We either fight back, run away, escape, or we freeze and do nothing. And if escape or defense seems impossible, then we end up with these sort of survival reflexes that take over, which can lead to other involuntary ways that the body and mind work to help manage our trauma. So some of these I've got listed here. One of them, dissociation. There's stories of people who are victims, who have gaps in their memory, but able to recall completely irrelevant information, such as the number of ceiling tiles in a room during the course of a traumatic event. And we as investigators need to understand that these impacts on memory are real. And we can't assume that a fragmented recollection of events is tantamount to poor credibility. We need to be prepared to be patient and work with victims to ensure that they have ample opportunity and assistance to share their stories. Dissociation is one of those things that can really create a terrible impact on a person's memory and ability to share their story. But that doesn't mean they can't still share a story that's useful and helpful to an investigation. But we have to show the patience and time to work with them. Another thing that sometimes happens in that immediate response is what's referred to as tonic immobility. So it's basically an involuntary paralysis where you can't move or speak. And sometimes there's what's called a collapsed immobility, and we've seen this demonstrated in many many fictional shows that we've watched where somebody just passes out. Well, that's real. That's a real thing, and it happens as a result of drops in heart rate or blood pressure, that again is our body's way of trying to deal with the trauma that we're experiencing. And some people might reflect on these involuntary responses in the moment and see them as failures on their part, and this further adds to their stress later on. So again, these are things that they're not controllable things. We all like to think that when we experience some kind of a trauma, we're going to respond a particular way, but we may not be able to. And that may be that there's an involuntary function that occurs that really prevents us from being able to respond or deal with that trauma in the way that we might believe that we could. Now, when we look at chronic responses, we're talking about some of the things that are consistent with post-traumatic stress. So, the thing that people have to remember is that trauma lives in our nervous system. And these responses are often, classified by those who lack understanding of these issues as, poor behaviors, the avoidance, the difficulty controlling their emotions. All of these things are really looked upon sometimes negatively. And we have to, train ourselves not to allow our own bias in dealing with people who have these issues to classify them as problems. Are they challenges? Well, sure, they're challenges for us as investigators because we need to work with people that experience these issues and help them to be able to share their information with us. But they shouldn't be looked upon as weaknesses. They shouldn't be looked upon as problem people. Some of the labels that there's a tendency sometimes to put on people. These are challenges that we as investigators deal with, but we shouldn't be looking upon them as indicators of deceit or manipulation or anything like that. These are some of the learnings that we have to take away from programs like this. There's a lot of biological, psychological, and social impacts that are experienced by people suffering from PTSD or trauma-induced anxiety. And so I've got this title, biopsychosocial impact, I can't hardly say it, biopsychosocial impacts. And so this is things like low self-esteem, difficulty focusing. You see the list here, I don't have to read it to you. But all of these are some of the impacts that occur as people cope with their trauma. And, the list goes on. Sleep disturbances, difficulty performing well, even routine tasks. People want to avoid people or isolate themselves. Using sick days and avoiding work, alcohol and drug use. All of these are some of the impacts that come out as a result of the traumas that people have experienced. Now, when we look at the emotions that are experienced by these folks, the experience of trauma can cause a big range of emotions. And, again, you can see a list here of a number of different things: shock, disbelief, shame, grief, despair. And these biopsychosocial impacts lead to a display of emotions that really, again, are sometimes seen by investigators as difficult. And I'm going to explain how it is we need to think differently and how we can think differently to deal with these things. We see many different outward signs of these emotions, and it's not unusual for us to see all of them in one person in a relatively short period of time. And I can tell you, I've done interviews with people where they started off appearing quite appropriate to the situation, very quickly moving to being upset, crying, then suddenly being angry, then moving from that to maybe having no expression or effect at all. And all of this can happen in a relatively short period of time. And it's going to happen even more so if we're having conversations with people, asking them to talk to us about the very trauma that has led them to be experiencing these emotions. Now, all of these things, as I said earlier, affect memory. Memory is affected by trauma, and we need to understand that. As we consider the approach we take in our interviews, we need to look for ways to assist people. Look at the issue around memory with a traumatic person. In many cases, it's really stored in a fragmented way. So recollection can be very disjointed. the chronological order of details might be inconsistent. And, historically, we would look at somebody who can't provide a chronological story or provide a story in a chronological manner. Historically, we would look at that as being somewhat questionable with respect to their reliability or their credibility. And that to my mind is something that, really is something we have to get past. Sorry, I apologize. I was trying to look to see if we have questions and I blocked my screen with that. So yeah, we need to be considering that memory is affected pretty dramatically by the experiences that folks have had. And, research has shown that emotionally impactful aspects are more vividly remembered and compared with when you compare them to less emotionally impactful aspects. So what I mean by that is, people are going to remember, one or two or three very specific things that impact them emotionally, but may not recall some of the more routine things, some of the more, even dates and times. We've seen examples of this when we've looked at, people who've lodged complaints about events that happened to them many, many years prior. And they can't provide a lot of detail about who was there. They can't provide detail about dates and times. And there's a tendency, particularly by those who would like to shoot down what that person is alleging, there's a tendency to say, well, they can't even tell us when it happened and we're supposed to believe what happened. When those kinds of things are happening, there is a biological and emotional reason for it. And our knee-jerk reaction should not be to assume because they can't remember certain details that they're not believable. So these gaps and inconsistencies in memory should never be seen as sole indicators of someone's credibility, their innocence, or their guilt. It's very important that we recognize that. Now, when we think about who experiences trauma, anyone can experience trauma, regardless of gender, socioeconomic status, religion, sexual orientation. It doesn't matter. These kinds of events can happen to any one of us. But the reality is that it's far more common for youth, impoverished, racialized, indigenous, and minority groups to experience trauma at a far greater rate than many others. So we need to understand the social context of trauma. So we've talked a little bit about what trauma is. We've talked a little bit about how it affects people and how it affects their memories. And now I want to talk about who experiences trauma and how that trauma affects people differently in terms of people's background. And it's very important to think about the social context of this. So when we look at some of the movements, and I have them listed here, we've got Pride, Me Too, Black Lives Matter. And when we look at a lot of these movements, we recognize that they're designed to address injustice in certain groups. And they all have a mission to help. They all have a mission to make people's lives better, to recognize the importance of gender, to recognize the importance of Black lives. And I can read all of these to you, but at the end of the day, all of these things are designed to try and make things better. But unfortunately, when we start looking at social media and the media in general, so I say here social media and media, they're two different things, although I believe they're starting to blur more and more over time. We have to look at the context of how these things are happening, because really what is happening is a pushback from those who fear change and those who allow their biases to influence their thinking. This is a desire really to sort of automatically push back. And a lot of this is based in fear. So, this has implications, obviously. There's all kinds of, if you remember the Me Too movement, when that was at its peak, there was all kinds of judgment, all kinds of very, very, people were very quick to react and to try and point the finger in a very inappropriate and inaccurate way at victims. And the Me Too movement shed light on how a lot of this was really being missed. The court of public opinion and the presumption of guilt around things really wasn't, there it wasn't working. There was no due process in that context. And so, if we remember back to the individual, oh gosh, and his name's escaping me right now, but Kavanaugh, who was trying to get or did ultimately become a Supreme Court justice in the United States. And we look at the circus that revolved around all of that in terms of him getting nominated and going through the process of being considered to sit on the Supreme Court. There were so many presumptions that were made. There were so many, the woman who brought forward the complaints, and I apologize, I can't recall her name at the moment, but the woman who brought forward the complaints against him was crucified in the court of public opinion. And in some respects, so was he. But the reality is that none of the opinions, none of the ways in which this was handled for the general public was appropriate, and it really made a mockery of the systems and the processes that we should have in place to properly adjudicate and consider issues like this. And all of this really ends up contributing to a mistrust. And that mistrust creates opposition and reinforces some of those social biases and beliefs that many people have. So we end up really with irrational arguments and actions from those who'd rather protect their comfortable world through fear-based and unreasonable concerns. Unsupported and irrational fears develop. I mean, I've got an example here, men fearing meeting with women alone. It really is ridiculous. People giving validity to and perpetuating race-based myths. And what happens is we get a vicious cycle happening. And some of you are probably wondering why I'm talking so much about this type of thing when you're here to listen to information about trauma-informed investigations. And I'm going to get to that. So don't fear, we're heading in that direction. Now, I want to talk a little bit about something called intersectionality. And really what that is a layering of injustices that people have experienced in their lives by virtue of their skin color, their heritage, could be their sexual orientation, gender, religion, and it compounds things for people. When people who struggled to find acceptance and justice and even tolerance are exposed to a traumatizing event, the ability to trust the system and feel safe in any way is even further from their reality than it is from most people's reality. And it's important to recognize, why this is important, because we're, part of our job as investigators is to understand and at least try to understand where people are coming from. Try to understand ways in which we can work with people to help them be comfortable, to feel safe. I mean, that's what this is all about. Trauma-informed approaches is about making people feel safe. And, when we take an intersectional approach, we recognize the complex ways that other forms of bias and inequity layer on to the experience that people have. It's again a further impact of their experience. And so responding and interacting in ways that promote a sense of safety becomes even more important. Now, I'm not suggesting that because if you're dealing with somebody who fits into one of those categories that I mentioned earlier, that we should automatically assume that they've been traumatized. I'm not going there. But what I'm suggesting is that if you're dealing with somebody who has experienced trauma and they happen to also fit into one of these other groups, it's important to recognize that their experience and their ability to trust may be even further away from their reach. And that becomes critically important. And it carries into the institutions if we allow it. Right? So we've got people who've experienced trauma, and in many cases, additional chronic social injustice. And we have a perception of them as difficult, unpredictable people who we may not identify with, or we possibly fear or resent due to the biases that we possess. And obviously, this is a problem if this is how we're thinking. And what makes it so much more incredible is the fact that they're putting their trust in us to be fair. So for us to be fair, it's time for us to take a look inward and to recognize, you know, when I'm talking about trauma-informed investigations, I'm not suggesting that you need to predict who's been traumatized or who hasn't, or how deeply affected they are by whatever trauma they may have experienced. Trauma-informed approaches are useful approaches to use with anybody that we're dealing with anybody that we're interviewing or managing through an investigation. These approaches and the ways in which we approach things really should be applied to all. You know, that's something that I think is really important, and we have to overcome these biases. It's up to us to level that playing field. It's not up to the victims of trauma or the victims of social injustice. It's up to us, right? So, you know, when we look at this type of thing, we look at you know, some of the things that we can really improperly bring to the process. Poor choice or lack of understanding language. You know, educate yourself around these things. You know, biased viewpoints. You know, often these are unconscious biases, and we're going to talk a little bit more about bias in a minute. You know, a desire for expediency. We just want to get it done. We don't have time to sit and spend an extra hour with somebody. We better make the time, because there are people who need that time. And if we're going to be fair and we're going to do things right, then we have to find the way to do that. You know, there's a lack of desire to learn and understand sometimes, and we have to get past that. Because if we don't, the result really is dissatisfaction and fear. Fear by some of the institutions and the processes that are in place to actually protect them. And that's just not right. It's just not good. So we have an opportunity. We have an opportunity here to really address the concerns that I've just talked about. The impact to investigations, if we don't consider trauma and bias, is nothing but negative. You know, we're obliged to consider the effects of trauma and adjust our approach accordingly. And to do this, well, what does that look like? Well, we have to consider our biases around all of these things I've talked about: gender, race, sexuality, sexual violence, and the list just goes on and on. You know, the consequence, if we don't, is a negative impact on the investigator's fact-finding approach and analysis, and ultimately an unfair investigation. So we have to address that continuing inequity. We have to understand our biases and the biases of others. We have to apply these trauma-informed services and processes to make it fair, but it won't be fair if it's not seen as safe. And we're going to talk about what are some of the specific things we can do to make people feel safe and make people engage. And we have to focus on accountability of ourselves and each other. You know, and if we don't do these things, then, you know, we're never going to get to the place we need to be. You know, when we think about biased perceptions, you know, we need to think about what our biases are. You know, and we have to be cautious about interpreting professionalism and credibility on the basis of biased perceptions like appearance, how people dress, whether they have tattoos. You know, right now you can't see me. If I was doing this presentation live, I'd probably roll my sleeves up right now and I'd show you all the tattoos that I have on my arms. I got all kinds of tattoos. Many people don't know that. Why? Because I cover them up. And why do I cover them up? Because when I'm in certain settings, I don't want there to be biased perceptions. If I walked into a room to deliver a talk and was wearing a short sleeve shirt with sleeves on both arms, people would look at me and say, who's this character coming in here to talk? Now, not everybody would, but many would. And I point this out because I think we all have to take a hard look at the way in which we judge. You know, and appearance is one of those things that we're very, very quick to judge on. Also behavior. You know, we look at things like gender roles, some of the stereotypes, ideas of promiscuity. You know, I mean, if we really want to get severe, you know, the people who have the nerve to say things like, well, you know, she's promiscuous, so she sort of invited this problem, making the victim the problem as opposed to dealing with the individual who actually is the problem. I mean, even accents can lead us to be biased. Somebody speaks with an accent. There's a tendency by some individuals to assume that because they speak with an accent, they're not as reliable in the information. They're not as intelligent. I mean, there's all kinds of negative impacts that come from this whole idea of accents. So again, recognizing our own bias is critically important. You know, and our biases can be conscious and unconscious. You know, and understanding our bias, well, you know, where does it come from? it's often rooted in our past experiences and our own profiles. I mean, think back to when you grew up and you know, what you were exposed to. How did your parents behave? How did your other relatives behave? Your other friends? What type of neighborhood did you grow up in? Did you grow up with money, or did you grow up a little more challenged? You know, all of those past experiences in our history over the years has impacted the way we see the world, the way we see others, and that, of course, impacts and creates the biases. You know, and you know, this leads to biases that affect how we view the world, and can influence investigators and decision makers. Not just the investigator here. I mean, we have committee members in our regulatory world that have to look at cases and make decisions based on the information the investigators provide. And they too can be affected by their perceptions of people. As investigators, it can affect the questions we ask, the things we even pay attention to. You know, investigators in regulatory context, generally speaking, are not the decision makers and are really fact gatherers. But are we paying attention to all the facts? Are our biases getting in the way of the facts that we actually gather, the ones that we put on paper? Is there missing information? The decisions we make in terms of how in-depth the investigation will be, what information we'll gather, how far we'll go in a particular interview. All of these things can be affected by our bias. And so it's really important that we recognize that. So what can you do about it? Well, there's a lot of things you can do about it. There is a great website, and I've put it here on this slide. It's a Harvard website that looks at implicit bias, and you can actually go to this website and take tests around a whole bunch of different things, whether it's related to race, whether it's related even to a person's size. There's all kinds of different tests that you can give yourself to kind of try to gain a little bit of an understanding of what biases you might have. And you might be surprised what comes out of it. Because again, not all of our biases are things that we are necessarily conscious of. So some of the things we can do to deal with this, well, consider your language. Exercise mindfulness about what you say and how you speak. You know, don't be afraid to challenge your own assumptions. Be accountable and hold others accountable when bias or inappropriate behavior occurs. You know, how many times have we been in a place where we see inappropriate behavior? We see people's biases coming out and how they treat others, and how many of us actually step up and say something about it or do something about it. You know, be empathetic to other situations and their backgrounds. And you know, I know that some of you are probably saying, you know, why is he spending so much time talking about bias and social injustice? You know, and the reason is because really they go hand in hand with being trauma informed. You know, the required insights are the same. The ability to drop your assumptions are the same. The required understanding to not look past, but rather consider the impacts of trauma are the same. Cultural humility will encourage you to consider myths and stereotypes, the sources of your information, potentially open your mind to new perspectives, all of which are the same components that form the foundation of trauma-informed investigative practices. So these are important concepts. And if you don't have an ability to get your own biases under control, then your ability to provide trauma-informed services or to be trauma-informed as you do your investigations, it won't be there. So it is important. It's important to recognize these things and apply them to the work that we do. So biases lead to myths. It leads to the formation of myths. You know, and I've got some examples here, you know, of some of these myths. One is, you know, women lie or make up stories about being sexually assaulted. You know, this is simply untrue. It's not even a reasonable thing to think. Do women really gain anything from making up stories of assault or sexual abuse? You know, and really this is the same for anybody fabricating a story. I mean, unless there's a really obvious motive for somebody to fabricate something, then, you know, it's pretty unlikely that they're fabricating. And, you know, where do these myths come from? Well, again, these myths come from our fears. They come from the people who want to defend themselves against their own actions and try to turn the tables and make the victim the problem. You know, and another example is sort of the unfazed strong and resilient individual, and we make assumption that that person hasn't been traumatized. But think again, if there's a lack of emotional expression, a perception of indifference, no apparent emotional sensitivity, this could be a sign of a person who's really failing to cope. What's being projected outwardly may not be what is happening internally. So especially if you see anger and combativeness, this is often a way for those who are traumatized to sort of mask that trauma, mask their fear, and mask their guilt. The thing that's important to recognize is that our biases lead to myths, and these myths can be devastatingly damaging to the investigations that we do, and we have to clear our minds of this kind of thinking. Sometimes people say, well, it didn't happen if the person disclosing the experience can't clearly recount all the facts. I can't remember what I had for lunch 2 days ago. So, I mean, really, and then people will say, oh, but, something as important or as horrific as that, of course they're going to remember all the details. In fact, quite the opposite is true. Oftentimes, as I said earlier, those traumatizing events affect our memory in a negative way. So people that can't provide the facts in order, people who can't identify witnesses, people who hesitated to report things to the authorities immediately, all of those things, are myths. If you think that any of those things are telling the tale of a person's honesty or a person's credibility or reliability, you really need to rethink that thinking, because it just isn't the case. So what are the implications on investigations? These myths that and biases and stereotypes, they interfere with how evidence is heard and understood and analyzed. So the investigation process and the outcomes can be compromised, because we're influenced negatively. Our perception of the complainant, the respondent, and the witnesses, how we perceive people often interacts or affects, or not interacts, but affects how we will deal with them, how we will talk to them, the questions that we will ask, our interpretation and analysis of information that's been shared with us. All of this is influenced by our biases and influenced, by even something as simple as being impatient, because it's taking a person a long time to get their story across, to share their information. So we have to consider that our assessment of somebody's credibility, and I know that for those of you that all of you are in the regulatory community, and you're thinking, well, what do you mean assessing credibility? You don't assess credibility. I would argue we do. I mean, we don't put it on paper, and we don't make comments about what we think about an individual's credibility. But when we're conducting interviews, you're darn tootin' that I can't believe I just used that expression, but we definitely assess people's credibility, because in conducting an interview, we are constantly judging and considering the information we get and determining what the next question is going to be and where we need to go and how we need to take this interview forward. Or do we need to do other interviews or talk to other people or gather additional documentary evidence? All of those decisions are impacted by the credibility of the stories that we receive, the credibility of the very complaint that's put on paper, all the way through to the credibility of the things that people tell us along the way. We're darn right that we're definitely assessing credibility. We can't comment on it, and we can't use it necessarily to put into our reports, but we definitely are considering it all the way along the line in terms of helping guide our investigation and take us in the direction that we need to go. So now that we've talked about what trauma is, who's impacted by trauma, who's impacted more by trauma, social injustice, bias, all of those things, let's talk a little bit about some of the trauma-informed best practices and what can we do to improve our approach. And bear in mind, in a few minutes, I'm going to start talking about interviewing and some of the specifics around interviewing in a trauma-informed way. But trauma-informed best practices, I've got 5 things that are worth considering. The first one is to receive training on trauma and bias. And so I'd like to think that some of what we're doing today is forming some foundation and taking you in that direction. In fact, I was working with one of our clients quite diligently before the pandemic to try and arrange for an expert in trauma-informed practice to provide a talk. We were going to sponsor it because I know that she could do far better justice to this than I can. But unfortunately, with the pandemic and everything that happened, that kind of fell off the rails. But when all of this, when the things return to normal, I'm hoping that we have an opportunity to do that. But receiving training on trauma and bias is extremely important. Familiarize yourself with the impacts of trauma. Learn how to identify and address implicit bias and increase your intercultural competency. These are things that will aid you and be the first step in becoming trauma informed. Respect the legal and human rights of all the parties. And I know that probably should go without saying, but we always need to be thinking about procedural fairness. And are the ways in which we're dealing with individuals who are victims of trauma, are they procedurally fair? Are we giving them the dignity that they deserve? Are we discriminating against them in any way? We need to be asking ourselves these questions and considering this. Apply that intersectional lens. I talked about intersectionality. Recognize how other forms of inequity like racism, homophobia, transphobia, ageism, all of these things can intersect with and add to the impact of experiences. So it's important for us to recognize that, take that into consideration. When we're considering credibility, consider it carefully. Avoid any kind of misinterpretation around, incomplete or inconsistent information as a sign of lying or evasiveness. That's not always the case. When I talk about credibility assessment, I talk about interviewing people and considering how we assess credibility. And over the years, I'm sure many of you have heard different people, even myself many years ago, talking about, we need to look at their nonverbal communication. Are they covering their mouth after they say something? Are they fidgety in their seat? Are they failing to make eye contact? All of these things. Many of these things have been, first off, proven to be mythical, especially the eye contact one. But also the whole idea of nonverbal cues to deception. Is it real? Is there something to it? Absolutely there is. Are most of us going to be skilled in using it, and can we rely on it? Not necessarily. And so when it comes to interpreting credibility, even in terms of how a person's sharing information, be very careful not to put all your eggs in one basket. Credibility is something that gets assessed from a variety of sources and a variety of analyzing information from a variety of directions. So it's really important to remember that and seek to clarify some of those incongruent and counterintuitive things that we see, whether it's the information we get or the demeanor. Don't minimize these things. You can misinterpret a person's willingness or consent in some situations if you're too quick to judge and not taking the time to clarify the things that people are telling you. Maintain impartiality in your fact-finding and your decision-making. All of your decisions need to be grounded in things like policy and procedure, the legal definitions and expectations, obtaining factual information. And yes, consider motivation or lack of motivation. I'm not suggesting to you when I talk about trauma-informed best practices that we don't still have a job to do as investigators. We still do. What I'm suggesting is that we need to be open-minded. We need to check our bias at the door, be open-minded to all possibilities, and not close off possible answers to things. Look at the facts, look at all the information, consider these things as you move through the process. Really at the end of the day, the problem when we don't do some of these things is that the principles and goals of natural justice and procedural fairness don't end up being aligned with the principles and goals of equity and inclusion, and we need them to be aligned, right? We want, when we talk about natural justice doesn't happen if there's not equity and inclusion along the way. So integrating trauma-informed and intersectional approaches with these foundational practices that promote natural justice and procedural fairness ultimately will enhance the investigative process and the outcomes. So this is not something that is just nice to know stuff. This is really how we need to be doing things. And it's extremely important. Now, I want to shift gears a little bit and talk more about some of the trauma-informed approaches to interviewing. This is really where the rubber meets the road in terms of what we as investigators do. When you consider particularly regulatory investigations, while documentation definitely serves a purpose and plays a role in our investigations, a lot of the information we gather boils down to the interviewing that we do and how well we do it. So remember, victims of trauma often experience negative reactions from others. And our guiding principle when dealing with victims of trauma is to do no harm, right? Many of the victims experience negative reactions even from their closest friends and family members. So the investigative system and the people involved with that system have a long, long history, whether it be regulatory investigators, disciplinary hearings, whether it be the court system, judges. There is all kinds of examples out there of the system and the people within the system trampling all over victims and making things really quite horrendous for them. And there have been people who've said that sometimes the experience that they've received through the system, the judicial system, has been worse than the experience that they originally had. That it's been a worse trauma to go through that. So, again, this is our main goal is to do no harm. And remember, victims of trauma, they will try to avoid, having to feel the way they felt. In other words, they avoid the feelings and thoughts or conversations about the event. They want to avoid places or people that are connected with the event. So again, that makes our job a little more challenging in several ways. I mean, because we have to take them there. We still have a job to do, and we still have information to gather. But we need to be aware of the fact that this is not a place that they're happy to be going to, and how we approach our interview with them definitely needs to take that into consideration. So number one is build rapport. Build rapport to create trust. Above all, they need to feel safe and respected. That is the number one. Any trauma victim needs to feel safe and respected in the process. And so how do you do that? Well, I've got a list here, but I'm going to talk a little bit about these things. We need to show empathy. So how do we do that? Well, maybe it starts with acknowledging their pain or the difficulty that exists in discussing the event. Demonstrate some gratitude that they're opening up, that they're willing to sit down and talk to you. Show interest. When I do interviewing courses, I talk about active listening and how important it is to actively listening, or to be actively listening, to definitely look at them, definitely nod, give the odd ask summarizing questions and clarifying questions, be engaged. That above all is going to be a way in which you're showing empathy, and you're doing that by being engaged. Be encouraging and supportive as well. All of these are things you can do that demonstrate empathy to the person you're dealing with. In terms of being patient, I'm going to be the first to tell you, I'm not the most patient guy out there. I really need to sometimes prepare for interviews with certain people when I know that it's going to be challenging, when I know that that it's going to take longer, it's going to take a little bit of a greater effort. There's going to be things that I've had interviewees look across the table at me and say, I don't think you should be doing this investigation. You are totally not the right person to do this. I don't have any faith in you whatsoever. And, I've had to sit and talk to them and reassure them and help to work with them so that they will feel that comfort with me. If I show frustration or I appear to be in a hurry, I want to get things over with, that isn't going to help create trust. In terms of reliability, it's very simple, but demonstrate that reliability through easy things. Like, if you book a time to meet with somebody and you're going to meet with them at 1 o'clock in the afternoon, meet with them at 1 o'clock in the afternoon. Don't be a minute late. That reliability helps to build that trust. Avoid miscommunications as much as possible. Be very clear in your communication because that eventually builds a sense that you are a reliable person, and they start to feel that trust and that comfort with you. They start to feel safe. And exercise transparency, explain the process, invite questions. Everybody I interview, everybody is given the opportunity to ask me questions at the beginning and ask me questions at the end. And in doing so, I'm offering a little bit of control to them. And that's an important thing to do. People need to feel that they have a certain amount of control. If they feel like they're just a pawn in a process, that you're just being used for information, you're not going to create trust. They're not going to be engaged. You're probably not going to get all the information you need. So offer some of that control by giving them the opportunity to ask you questions, and that can go a long way. Pay attention to physical cues. Now, earlier I said, oh, don't worry about physical cues. What I mean by this is when I'm talking about physical cues in this context, I'm not talking about it from the perspective of assessing credibility. I'm talking about it from the perspective of maybe recognizing a person needs a break. Be compassionate. Look for those physical cues. Person starts to get very agitated. They start to maybe looking around the room. They're look for those things. They start to cry. Recognize it and respond compassionately to it. Provide breaks. Offer water, and check in to see what they need. Ask them if they need anything. One of the things that I think is very important is to allow and promote that uninterrupted narrative. Use open-ended questions. Let them tell their story the way they tell their story. Let them have the ability to tell you what they are comfortable telling you. You can probe more later. You can ask clarifying questions, but initially, let them tell you the story. Let them share their story with you. That empowers them. That gives them. Now, some people don't want it, and you'll know right away. And then you might have to switch to asking questions, but directly. And you will ask those questions, but initially, at least, try to promote that uninterrupted narrative by just letting them tell their story. Let them tell it how they want it. So don't insist on, chronological order. Tell me, start at the beginning and tell me what. No, just let them speak. Don't ask, blaming questions. Don't ask why, or blaming or judgmental questions that can play into the myths, and really can put them on the defensive. Now, does that mean you don't have to ask tough questions? No, you definitely have to ask tough questions because that's part of your job. But you can ask those questions in a way that frames them so that they are not coming across as judgmental or blaming or accusatory. That's the way you have to approach it. So what are some of the things we don't want to do? We don't want to ask these blaming and judgmental questions. So, and I've got some examples here. Why did you remove your pants? Why did you go there? Were you drinking or taking drugs? Are you sure that's what happened? Did you say no? Why didn't you say anything or scream? All of these questions are somewhat blaming, somewhat judgmental, and somewhat accusatory. And people who get questions like this are going to feel, really they're going to feel a little bit closed off. They're not going to feel comfortable with you. They're not going to trust you, and they're not likely to share the information that you need. But you can still get the answers to a lot of these questions if you ask the questions a different way. So how can you do that? Well, here's a few examples of how you can ask those questions differently. Start off with tell me about the experience, or tell me about the incident. Encourage them to start wherever they would like. Sometimes people say, well, where do you want me to start? Or whatever you're comfortable with, you can start wherever you'd like. Now, there are other people who want direction. There are other people who won't like that. And again, you've got to be ready to adapt, right? You've got to be ready to adjust to what they need. But some people want direction. Some people want to be given the freedom. So, try to gauge that and respond accordingly. Ask them, what was the most difficult part of this experience that you had? What was your thought process when you removed your pants? As opposed to why did you take off your pants? Was there a reason you were not able to call out for help? What sounds or smells do you recall? Again, people oftentimes will have things in their memory that they can't draw on easily. And so when you ask a question like that, sometimes it's helpful to draw out of them information they might not have otherwise shared. What do you recall feeling emotionally or physically at the time? These are the kinds of framing of questions that will really help the person feel comfortable and be able to open up. So again, have them describe their incident without interruption. Demonstrate that active listening. Don't keep your head down writing all the time. Try to make eye contact or look up and nod your head. Engage with the person. Obviously, make notes to remind you of questions or points that you might, get clarification on later. Because if you're going to let them tell their story, there's guaranteed there's going to be gaps. Guaranteed there's going to be things in there that you're going to want to go back to. So keep a scratch pad handy and make notes of those things. Don't feel like you have to interrupt them to get clarification then and there. Make a note of them and then circle back to them later. And let them move at their pace. Don't force them to move more quickly than they might be comfortable doing. Now, I mentioned earlier, you still have to ask the difficult questions. You need to be thorough. You still need the full story. Trauma-informed interviewing doesn't mean you get to skip the hard parts. I get it. Sometimes it's hard for the investigator too. No comparison to what the victim's going through, but trauma-informed interviewing doesn't mean that, we're just going to gloss over the stuff that's difficult to talk about. You don't get to do that. It really comes down to how you ask the questions. It's not what you're doing, it's how you're doing it. That's really what you need to adapt and develop, is that skill of framing questions in a way that allow these folks to feel more comfortable. In the end, you still need to ask hard questions. And if you frame them carefully, as I've spoken about already, this is where you'll be successful. And so preparation is very important. If you know you're going to be dealing with somebody who's alleging a traumatic event and they're going to have to talk to them about it, prepare for that interview. Consider how you might frame some of your questions. The interview preparation is just as important as the interview itself. If you're not ready and you haven't figured out what you're going to ask and how you're going to ask it, most importantly, how you're going to ask it, give a little thought to that. Consider the importance of that. In terms of closing the interview, close with thanking them and praising their effort. Obviously you're going to provide your contact information and provide the next steps, if possible, But again, going back to that issue of reliability, don't provide a timeline that you're not going to be able to stick to. Under promise and over deliver. Don't do the opposite. Okay, that's very important. Reliability extends way beyond the interview to the later stages of the process. Because I'll tell you, as the investigator, if the person you're dealing with experiences a negative or has a negative experience with you, how do you think they're going to manage later if they have to deal with a prosecutor? If the case goes to discipline and they have to deal with that, how are they going to manage that? That's something that I think is really important to consider. And leave the door open for further interviewing. Don't bank on a second interview, but leave that door open. Give them an opportunity to ask further questions. Again, I mentioned that earlier. You want to give them a little bit of control. So let them ask you any questions they have. They might ask questions about what's going to happen. And, some questions you'll be able to answer easily, some not so easily. It's really going to depend. But this is extremely important in terms of how you're going to manage closing the interview and keeping that door open, and building that trust and that safety that you want that person to feel. So I want to talk a little bit, just to round off this discussion, I want to talk a little bit about vicarious trauma. And so what do we mean by vicarious trauma? It's not the same as burnout or compassion fatigue, which we certainly hear about. Those things happen to people. Oftentimes they happen to people in the helping professions, and it's usually a result of some level of emotional exhaustion, a reduced sense of personal accomplishment. Because what happens is they get overwhelmed with their workload and they perceive that they're really not successful. They're really not having the positive outcomes. Many of the people we deal with, witnesses, complainants, well, maybe not as much complainants, but many members or registrants of regulatory bodies are people who might be experiencing things like compassion fatigue, emotional exhaustion and burnout, and that's not unusual. But what I'm talking about here is something a little bit different. I'm talking about what they call vicarious trauma. And so, when we hear people's firsthand accounts of trauma, that can have a negative impact on us. And so it's important that we practice self-awareness around changes to ourselves, our mannerisms, our attitudes, that we really can't explain any other way, changing in our thinking style, so if you exhibit irritability, fatigue, nightmares, angry outbursts, hopelessness, these are all potential signs of vicarious trauma. Changes to your thinking. For example, minimizing or magnifying things, where you select qualities in yourself or others and either minimize or magnify them into gross generalizations. Blaming yourself, for everything that went wrong when clearly there were other factors. When this type of thinking starts to creep into your psyche, you should be trying to gain some awareness of this. Catastrophizing. We overthink a situation and focus on everything that can go wrong and how life as we know it is going to be ruined. When we start thinking like this, or even overgeneralizing, taking one instance and assuming everything is going to be like that, these types of behaviors or thinking that is a telltale sign of the presence of vicarious trauma. And it's really important that we as investigators take care of ourselves, recognize our own mental health is important, and if we don't do that, we're definitely going to fail in the long run, because we're going to not be effective. So how can we prevent this? What can we do about it? Well, I've got a few ways here that will help to manage some of the difficult work we do. One of them is to manage time between meetings. So take time after a difficult interview to ground yourself. Maybe debrief with a colleague, somebody who you can talk to. Say, oh my gosh, I need to get some of these thoughts out of my head. I need to process this. When you just go from one difficult situation to the next, and then your day comes to an end, and then you go home to your family, and your focus then is on other things, but these things, you haven't had time to process these things. This can be difficult for you, and it can lead to a buildup, and then eventually to some of that thinking that I mentioned earlier. Take breaks when things get too intense. Acknowledge that the intensity of a topic is great, and when it is great, and it feels like a break makes sense, offer that break. And you can say something like, you've shared a lot of upsetting details. Maybe now would be a good time to take a break, or I can see that that maybe it's time for a break. You have to do this in a way that doesn't come across as sort of accusing them of not being capable. Again, always recognizing the language and the words that you use and how it might affect the other person. It's nothing wrong at all with saying to yourself, hey, you know what, I'd like to take a break if that's okay with you. You don't have to say why, but that might be a helpful thing to do. And then when you take that break, it gives you an opportunity again to kind of ground yourself, to take a few deep breaths, and shake it off, so to speak. Again, self-awareness and mindfulness is very important. If you feel distressed or uncomfortable, recognize that this is a sign that you need to take a pause in things, and accept human emotions. The more aware and accepting you are of your own emotions, the easier it is to avoid being overwhelmed by them. So, have the emotional response and move on rather than being scared. So, if again, you've got to, if somebody's telling you something and it's so horrible that you feel you need to cry, it brings on that emotion in you. You've got, I get it, as an investigator, you've got to you want to try and hide that. And I don't think you want to start, breaking down in front of the person you're interviewing. But again, recognize that these emotions are normal. Take a break, do what you need to do, and get back to it. And if later on, when everything is over, sobbing is what seems like the appropriate thing to do because that's what your emotions are telling you, then let that out. Don't be that person who says, well, I can't let my own emotions get the better of me. They're not getting the better of you. There's a normal reason why that's happening. So with that, I'm going to open it up for any questions that people might have. I do have another slide here that with some sources of information that was used to prepare this presentation. So when we post this on YouTube, people will be able to look at this, I guess they could pause the presentation and look at it as long as they want. But that being said, does anybody have any questions about anything I've spoken about? Don't all ask at once. Sorry, I'm just going to the chat to see if anybody said anything in the chat. Okay, question. So somebody's asking how to strike a balance between compassion and objectivity, and that's a really good question. And I think it's a difficult thing. I mean, when we're trying to demonstrate compassion, but at the same time, we don't want the person to develop an assumption that we're sort of advocating for them, that we're on their side. I think that that's a difficult thing to do, and that's going to come down to language choice. I can say to somebody, for example, I always avoid the word "I understand." By the way, it's a word I try not to use, but I could say to somebody, I recognize that this is very upsetting for you. Maybe they're crying as they're trying to tell you the story. Or maybe the person says to you in the middle of the interview, can you believe he did that to me? Obviously, you can't respond with something along the lines of, no, that's horrible. Again, focus it on what they experienced. Focus your language and your commentary on what they experienced. I can see this is very upsetting to you. I can see this is, this has caused you a tremendous amount of grief. Again, it's that empathy and that compassion. Maybe focus as well on, this is a difficult thing for us to talk about. So you can show those kinds of compassionate responses without saying words that compromise your objectivity and make it seem like you're on their side. And that really just comes down to language choice. I've got another comment here. How do we maintain a rapport for these sensitive interviews if we're conducting them virtually? That's another great question. Virtual interviews, we're finding that virtual interviews can be very effective. We're not seeing it as a huge hindrance to the investigative process, but it definitely is a lot more difficult. I think one of the things that I like to do if I'm dealing with somebody who's experienced trauma and somebody who's having a difficult time is try to give them an opportunity when we're setting up the interview to allow them to have a support person present. Somebody that's not a witness, that's not necessarily a part of the investigation, but somebody that they trust and can feel comfortable with, who can kind of advocate for them in the sense. And some of them might have lawyers who might fulfill that role, but in many cases, we're talking about the complainant here in most cases, and they aren't necessarily going to have a lawyer present, but maybe help them with a support person. And again, be extra aware. Maybe because you're doing the interview virtually, check in more with them. Ask them how they're doing. Ask them if they need a break. Be a little more proactive in trying to support them, as opposed to if you're in the same room, you sometimes get that feel, you get that feeling, that sense. You're able to observe a lot more than just their head and a screen. So maybe be a little more proactive in asking them how they're doing and asking them if they need a break and that kind of thing. Somebody made a comment that they've noticed recently that in video conferences, people's faces are pointing in other directions. And he's tried to put the window that he's looking at close to the webcam. This may help to point my eyes and face toward the person I'm interviewing and reduce the social distance between us. That's actually a really good point. I've noticed that about myself as well. When I'm in meetings, sometimes the picture of the person is in the bottom right corner, especially if we're looking at a document or something together. So my webcam's at the top of my screen, their picture's at the bottom, and we all have a tendency to want to look at the person as we're talking to them. So they, all they see is maybe a glancing side view of my head as I'm looking down when I should be looking into the camera. So one of the things I tell people is just be very cautious or aware of the camera, and look into it, pay attention to it. It's there for, but again, that's easier said than done. Something we have to train ourselves in, this sort of new normal that we're operating within. Another person asked a question: have you ever been challenged or criticized by an adjudicating body for using trauma-informed techniques in an investigation? And if so, how did you respond to this? I can't say that I've ever been criticized. It hasn't come up, and I think that's probably because maybe, especially in the regulatory context, when I'm gathering information from somebody and I'm using these techniques, those techniques, unless the interview's been recorded, which it often is, but it isn't often listened to. At the end of the day, within the report, the person's only going to see the factual information. And so the trauma-informed approach isn't really going to come through in the written word. So in that respect, I haven't experienced that. But for the individual who asked the question, if you want to make another comment, and if this has happened to you, I'd be interested to hear about it, and it might be helpful. So feel free to make another comment and provide your example. Somebody else has asked, is there any tips for identifying a trauma-informed response versus when a respondent is intentionally being evasive or lying? Any specific things to look for to help sort out the difference? Well, that's really the $100,000 question right there, right? It's a difficult thing to sometimes to be able to recognize that somebody is being manipulative or evasive or lying. For me, a lot of it is a gut feeling as I talk to the person. As they tell me their story, I'm considering what they're saying to me and how they're saying it, and I'm looking for inconsistencies. Sometimes it's just so obvious because the person might focus a little too much on. Oftentimes we have to draw out of people how something made them feel. But for somebody who's being manipulative or who's lying, they don't have a lot of facts to share, or the facts they're sharing, what they want to do instead is talk about how the situation made them feel. So if I get somebody who's really short on facts but long on this made me feel this, and it's done this to me, it's done that to me, and they're going off on a tangent, that oftentimes for me is a bit of a red flag that I might want to pay attention to, and that's going to lead me to just ask more questions and try to address that by going more in depth and refocusing them on facts, and then analyzing those facts with them. Somebody else asked, some complainants are very organized, have kept detailed notes over years, and I've observed some investigators to assume that this person has not experienced trauma because they are not in a disaggregated state. Example, if you were traumatized, why did you go home and write it all down? I wonder about that assumption. What are your thoughts? Well, I don't agree with that assumption at all. I think that, again, we all deal with trauma differently, as I said at the outset of the presentation. I think we all have different ways of responding to things. Some people like to keep a journal. Some people like to write things down. I suspect that somebody who's experienced trauma, who's kept detailed notes of what they've experienced, reading through those notes in their entirety, as challenging and time-consuming as that might be, you may see those notes become more and more detailed as time goes on. You may pick up patterns within those notes that could be very telling. I don't think that because somebody writes down and keeps detailed notes that they weren't traumatized. Is that typical of a traumatized individual? I don't think it's typical, but I don't think it's necessarily atypical either. I think that the key word in all of that question is the word assumption. I'm not so sure it's safe to assume anything. And I think when we start making assumptions about things like that, we do ourselves and the people we're doing our work for a disservice. In the end, after we've interviewed that person and interviewed other people and gathered all of our information, the truth is going to start to present itself. and making assumptions early on in the process are not necessarily going to be is not necessarily going to be helpful to us. I think it's better that we wait until we've gathered all our evidence, and then we can start to draw some conclusions or analyze the information in the light of all the information we've gathered. The person who another person said, I found it's important to rely on recent research to challenge the myths relied upon historically to adjudicate decisions, because trauma-informed interviewing is still an emerging concept and not many prosecutors are fully versed in it. I feel comfortable in challenging the old norms. Yeah, I agree. I mean, I think that it's very important to challenge the old norms. I mean, there's some case law that I reviewed. I didn't share it in the context of this presentation, but there's some case law that I reviewed that spoke to and provided some incredible examples of a complete lack of understanding trauma and a complete absence of any kind of a trauma-informed approach. In fact, one of our investigators recently dealt with a legal counsel on a case where it was glaringly obvious that this legal counsel had zero understanding of trauma and trauma-informed approaches and the way trauma affects people's ability and behaviors. So I agree 100%. I think that the research is ongoing, and this is why I mentioned earlier the person that I'm going to that I've been speaking to. Her name is Lori Haskell, by the way, and she's actually one of the authors on some of the sources of information I used for this presentation. And she's the individual who we've been working toward getting to provide a talk. And she's one of the people that I think is on the cutting edge of this and will be a very useful resource for all of us. And so that's still going to happen one day, I hope. But I agree with you entirely that we do need to stay abreast of the recent research. Now I'm just going to switch over here to the chat, because I think some people might have asked questions on the chat as opposed to the Q&A. So question, how do you balance between giving the witness survivor time and meeting timelines in terms of the investigation process? Example, a witness survivor who wants to participate in the process but requests constant extensions. That's a real, I agree with you. That is a real challenge. I think that people are I mean, we've got to find a balance. It's all about striking a balance, right? So obviously we definitely want that survivor, that victim, that witness to be able to do things on their own time. But I think it's about setting the stage at the beginning and having that conversation and making it clear to them. I mean, regulatory bodies are constantly being criticized for how long it takes them to get cases completed and how long it takes them to move forward with things. And I think, you know, one of the things we have to recognize is that while these individuals and these victims of trauma require a different approach, they're not so fragile in most cases that we can't have an honest discussion with them. And again, I think, as I mentioned earlier, that all of this is about creating a safe, open, transparent, and honest relationship with the individual that we're dealing with. And so part of that honesty is saying to them, listen, we've got timelines that we need to meet. You know, we don't want there to be criticisms later that can jeopardize a case one way or the other because things took too long. So yes, we want you to participate. Yes, we're willing to give you some extension, but we've got to balance that with the need to move the process along at a pace that doesn't jeopardize it. And I think maybe just having those honest discussions with the person will help. Will it work every time? Maybe not, probably not. But it's one approach to maybe trying to manage things. Okay, I don't see any other questions here, and I just want to say thank you to everybody who attended today. I'm just going to move through the slides here to, there's the sources again. I'll put that up on the screen. Actually, I think maybe what I'll do is stop sharing my screen so I can you can all see me again. Not that you necessarily want to. There we are. So, so thank you all very much for attending today. As I always say, you know, the one thing I don't want is people walking away from spending 90 minutes with me and saying that's 90 minutes I'm not getting back. I really hope that something today was helpful to you, that that you benefited from this, and sincerely appreciate you coming out and checking out what I had to talk about today. The YouTube posting is going to include the presentation slides. Somebody just asked that question, and thank you for those of you that are saying well done, and I appreciate that. This has been a lot of fun for me to do, because I think it is important, and I'm very proud to be able to make some contribution to this. So thanks to all of you. I wish you all the very best during these crazy and uncertain times that we're all managing, and we'll hope to be putting forward another webinar in the not too distant future on something. And here I am looking down when I should be looking at the camera. We just talked about that. Anyway, thank you all very much. All the best, and happy holidays. Bye-bye.